Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan. Thank you for joining us. We're here with our co-host, Dr. Ruvain Rubenstein out of Troy, Michigan.
How are you?
And our special guest, Dr. Sarah Rubenstein out of Troy, Michigan as well.
Right.
Welcome.
Thank you for having us.
So we're going to talk a lot today about pregnancy and chiropractic during pregnancy. And I know, Dr. Rubenstein, that you're currently, how far along in your pregnancy?
35 weeks.
35
I'm getting close
weeks.
to the end.
All right, and what number is this for you?
This is our third child.
Third child, all right.
And with all three, we've been under pretty regular chiropractic care.
That's fantastic. And that's one misconception a lot of people think, even people that may see a chiropractor regular, that once they're pregnant, they may not be able to have chiropractic care during the pregnancy, that it may harm the baby, anything like that. And that is very far from the contrary, isn't it?
I mean, it's a big misconception, like you were saying. You know, the nerves that lead to your reproductive organs come out of your spine. So, I mean, if there's any type of misalignment in your spine that lead to those reproductive organs, you can have problems with back pain, problems with breech position of the baby. All these different things can occur because of something so simple as correcting a subluxation.
Even potentially problems with development or even conception in the first place. Is that possible?
Absolutely. I mean, everything is going, the mother's basically a host to the fetus inside, so if all the information that's going to the baby is being interfered with, the development of the brain, organs, all the tissues of the newborn fetus inside the belly of the mother, it needs the right signals and information to grow properly.
It needs nerve supply, blood supply, everything. And you can see that the brain controls all signal. Trillions of impulses start right there from the brain, goes through the brain stem, through the spinal cord, and again out to the reproductive organs here. And so we do see actually some patients in our office that are having infertility, and oftentimes we have great results with that. Not that we're curing their infertility or helping to get them pregnant, but by keeping normal, healthy nerve supply, the body can just function that much better. Now there's a lot of different issues or causes of infertility, and not to say that we as chiropractors can cure or change those, but again, working with the nervous system in the area that controls the reproductive system, if there is interference or irritation at those nerves, removing pressure through gentle chiropractic adjustments can absolutely improve function.
Yeah, I mean, we're not trying to, like you said, we're not curing anything, we're just allowing the body to function the way it's intended. Women are supposed to be able to get pregnant. People that have infertility, there's usually a reason. Sometimes it's non-curable, sometimes under chiropractic care we can actually get great results, and the mothers actually get pregnant. We have a case study here of a 31-year-old woman under chiropractic care. She was not able to she tried to get pregnant for 3 years, 3-year history of trying to get pregnant, couldn't do it. She had problems with menstrual pain, she had heavy menstrual cycles, and under chiropractic care she got pregnant 2 weeks later. So 3 years of trying, she started chiropractic care, 2 weeks later she was pregnant.
That's a great case study.
Yeah.
Now, does it always have to be the woman under chiropractic care that could potentially help, or could it be the man as well?
Both. I mean, also, the nerves are also leading to the man's reproductive system. If he's got a problem, the sperm count could be low because the signals from the brain are not functioning properly. So it works both ways. We
see results even with, not necessarily to do with the pregnancy right away, but even ED, all sorts of different reproductive problems in men as well. If a lot of times they'll come in with the symptom of just lower back pain, excruciating lower back pain, but the nerves are irritated that control the man's reproductive system. And obviously if that is interfered with, that could interfere with conception as well.
Yeah, absolutely. And let's talk about, so once the person actually is able to get pregnant, then we want to make sure the baby's going and growing, and also the mothers have a lot of symptoms that can occur from being pregnant.
Sure.
It's a lot of extra weight on them. So do you have any stories of something that you've seen, like maybe back pain that you've occurred that didn't happen and then occurred when you were pregnant?
Actually, when I was pregnant with our second child, I thought I was too busy to be able to go into the office, and it was almost immediately I started having this horrible low back pain, which I had never had with my first or with my third, and as soon as I got back under care, it went right away.
And they say every pregnancy is different. Some of the symptoms can be different, and during the pregnancy, your spine is not only working for one person, it's working for 2 people. So it's even more important to keep that spine healthy.
Yeah, if you get all those, the relaxin is something that gets released from your body when you're pregnant, and what happens is it relaxes all the ligaments and tissues of your hips so the baby can have an easy delivery. And and that relaxing can actually cause a misalignment that would put pressure on those nerves, and a lot of women get sciatic pain and all these issues because of the pregnancy. I know we get a lot of great results.
Causes ligaments to be more lax and loose in the lower back. Even in the feet, we see that's why women's feet sometimes kind of spread, because they're more relaxed. The bones and everything really relax, and it can open up everything.
Yeah, it looks, some say, oh, it looks like my feet are swelling or stuff like that. It's actually their bones are separating a little bit. Just
from the relaxin and oxytocin, some hormones that they produce during pregnancy. Now we have a video clip actually of a testimonial of a woman under chiropractic care in our office during her pregnancy, and how effective and gentle and easy it is for her. And then we'll also walk you through another pregnant woman getting a chiropractic adjustment, so our audience can see what it actually looks like while a pregnant woman gets a chiropractic adjustment, and how gentle, how easy it is, and how effective it is.
Yep.
So we'll go ahead and we'll roll that clip.
Hi, my name is Crystal, and I'm 3 weeks pregnant. I've been coming here to Rodnick Chiropractic for a few weeks now, and it has really helped me through my pregnancy. I know it makes a difference with my body and the baby. It relieves stress in both areas. My life is completely better. I was in so much pain from car accidents and the baby weight that now it's relieved much of my stress and my pain.
So there's a common misconception that people can't have chiropractic care while they're pregnant, and that's absolutely a falsehood. And what we're going to do today, we're going to do a walkthrough. This is Jody, and she's expecting her second child. We're going to do a chiropractic adjustment with her today during the pregnancy, and a couple things that are really great during pregnancy. One is if the hips and pelvis are more level, a lot of times it makes for a little smoother and easier labor and delivery process. And throughout the pregnancy, the spine and the nervous system are working for two people, so we want to make sure that we keep the spine and the nervous system as healthy as possible. So we can lay facing down, and what we do a lot of times with pregnant mothers as the baby starts to develop is we lift our table up. We have a special pillow to help cradle the baby. And a lot of times what we'll do is we'll first check the legs, and checking the legs is an indication of how the pelvis is. If the pelvis is rotated a little bit, it will pull up on the leg, creating a little shorter measurement with our leg. So we can see today with Jody that the left leg is a little bit shorter than the right. And one of the checks we do, this is from the Webster's breech baby technique. We bring the legs up like this and look for restriction there as well. So as I work on her, you may hear some little noises, and all that is, it's not really her bones cracking, snapping, or popping. All it is pressure. Basically air bubbles, CO2 and nitrogen gas coming out of the joint capsule. Now let's stand right on your side here, Jody, facing towards me. And she comes out. I'm going to take the pregnancy pillow out here. I'm going to work on her pelvis and her lower back. As the baby starts to develop, it puts a lot of extra tension, a lot of pressure on the lower back, which is why a lot of pregnant women get a lot of lower back pain, and even sciatica, which is irritation or pinching in the nerves in the lower back. They go down the leg in the sciatic nerve distribution area. Now stay right on the other side. A lot of people ask if, with an expecting mother, will it hurt them, will it hurt the baby? Does it hurt at all, Jody?
Nope, not at all.
Yeah, let's lay right on your back there. Go ahead and sit up nice and easy here. We'll go to the side. Go. I'm just going to check her neck here. All right. And that was our pregnancy adjustment.
So as you can see, chiropractic during the pregnancy is safe, effective, and gentle. Most women are also afraid or worried that they won't be able to lay even on the table because they can't lay on their belly once they're in the second or third trimester. And as you can see, we lift the table up. We have a pregnancy pillow that can cradle the baby, and we can adjust people even till after their full term and until they're late even. And we see that regularly as well. And another thing is a lot of women may be afraid that it would hurt them or be uncomfortable during the pregnancy. Now, yourself, Dr. Rubenstein, when you get adjusted during your pregnancy, is it uncomfortable? Does it hurt?
Not at all. And actually laying on the pillow just gets rid of so much pressure that you can feel on your back and sciatic nerve.
So if you could explain, what is sciatica and why would pregnancy increase the likelihood that someone could get sciatica?
Go ahead and take that, Dr. Rubenstein.
So sciatica, I'll talk about this. So sciatica is the two nerves that lead into the lower part of your legs from your low back of your spine. It's in this area right here. What happens is when the sacrum, this bone right here, gets out of place due to the pregnancy, that relaxing we were talking about earlier, it can put a lot of pressure on these nerves coming out of your spine. When the sacrum now expands with your pelvis, the nerve pressure starts sending shooting pain down the back of your legs. I know a lot of people have heard the term sciatica. They may not know exactly what it is. What it is pressure on these nerves down this area of your spine, and it sends shooting pain down the back of your leg. And a lot of pregnant women get this because of those hormones that are released and because of the extra weight as well that they're putting on in the pregnancy. And under chiropractic care, we get amazing results just realigning the hips to make sure that we take the pressure off those nerves.
Absolutely. And a lot of people think the term sciatica is just like a leg pain. It has nothing to do with the actual leg.
Yeah.
The nerves at the bottom, few nerves of the lumbar spine, they go down and they form the sciatic nerve in the back of the leg. If you pinch or irritate them in the back, they travel down the leg. So we make adjustments to the hips, the pelvis, the sacrum, or tailbone, and the lumbar spine or lower back to keep pressure off of those nerves so that it doesn't travel down the leg. It's a very common symptom, not just during pregnancy, but other times as well, but specifically during pregnancy because so much extra and added pressure is put onto the lower back, the pelvis, and the sacrum.
I mean, chiropractic care in general is amazing for you, but we want to make sure that your spine is aligned while you're pregnant because it's not just the person who we're taking care of. We want to make sure that fetus is properly nourished and properly taken care of. We want to make sure those signals are getting to the fetus so that there is no later issues going on. I mean, if you see ADHD, autism, all these things are on the rise, and there's studies that show it could have been caused by something that happened while in the womb. Yeah.
Yeah, and we want to make sure even not just that the spine is healthy, that the nerve system is healthy during the pregnancy. We want to make sure there's room in the uterus, there's room for the baby to maneuver and for the baby to get in the right position to move out.
Yeah.
That brings us into another technique that we use in chiropractic called the Webster technique. And if you could explain that, what that is, and have you had that done to yourself before?
I have had that done. It's very gentle, and basically what it is the doctor will check first the sacroiliac joint, and then they put a little bit of pressure onto the round ligament that helps to hold up the uterus.
So what is the sacroiliac joint? That's another word people may have heard but may not know what that is.
So the sacroiliac joint, I'll grab this. It's the two joints that connect the hip joint and the sacrum. So those two joints right there can get a lot of, it can get stuck a lot when you're pregnant. All the time, a lot of people have misalignments in this joint, and it can cause a lot of those issues, pain.
And a lot of people will use the word hip when they think of the things on the side here. Mm-hmm. Those are actually pelvic bones, right? And that's where when the pelvis meets the sacrum, that's the sacroiliac joint. It's not actually called the hip. It's kind of a layman term. The hip joint is a little farther down where the leg attaches into the pelvis. But where the pelvis meets the tailbone, if this is our tailbone, it looks like a triangle. Here's the pelvic bone, and this is the sacroiliac joint. So with that Webster reach technique, we work on the sacroiliac joint, correct?
Correct.
And then what is the round ligament?
It helps to hold the uterus up, and then we see a lot of times with women who have babies that are malpositioned that it's very tight. And just to put a gentle pressure on it can relax it enough so that the baby can flip into the position it should be in.
So talk about flipping into position. I mean, a lot of people I'm sure have heard the term breech labor, breech pregnancy. And what a breech pregnancy is, so a baby's normal position is supposed to be, once it's grown to full term, is head down, facing in towards the belly. What happens is if you have these problems that we address as chiropractors, like that round ligament's tight, sometimes the baby doesn't have a lot of time to flip into the right position. So what happened about 30 years ago, Dr. Larry Webster created a technique for flipping these children. It's a simple 2 adjustment move, and what happens is we relieve the pressure off that ligament. So it's the International Chiropractic Pediatric Association is the biggest pediatric chiropractic association in the world, and they go around and they teach chiropractors this technique so that the mothers can get better results for their labor and pregnancy.
It's a very good technique. We use it all the time, and it can definitely be very effective for flipping a breech baby around. And there's a few different breech presentations that a baby can have, whether it's their feet first, whether it's the bottom first. They could be side lying, all sorts of different ways. And the technique has different variations of contacting the round ligament and the sacroiliac joint to reposition the baby, reposition the uterus to get the baby to be in normal presentation, to make for a much easier and smoother labor and delivery, as well as just keeping the pelvis lined up. Because imagine if just the pelvis is tilted, how it can affect labor and delivery as the baby is coming out of the birth canal. So we work on pelvis, sacroiliac joints, lumbar spine, just to make sure that there's enough room, enough mobility there.
And one of the big problems that, I mean, you see the C-section rate is rising in this society. It's, I mean, back in the 60s, 70s, C-sections were 2-3%. Now they're rising. And one of the main reasons for C-sections is that breech position of a child. So, I mean, if we can go in as chiropractors and help flip this baby into the normal position, not only are we helping the baby and the mother, we're preventing surgeries from happening. I mean, surgeries, the last thing you need when you're having a baby is to have to recover from a surgery as well. So, I mean, we're getting amazing things, and chiropractic, it works. It helps a lot. And I have a study here of a 35-year-old woman who presented to a chiropractic office with their baby in a breech position, and she was on her 30th week. So that's pretty late in the pregnancy. 30th week, so that baby's already pretty full grown in that breech position, and after a few chiropractic adjustments, flipped and had a easy, successful labor. That's
fantastic. We have another video clip we'd like to roll with a mother postpartum, just after she had her baby, talking about her experience with chiropractic during her pregnancy and how it made for a smoother and easier labor and delivery process. And we'll also have a clip of Dr. Rubenstein here actually undergoing the Webster technique, so you can see exactly how gentle and easy that is where we put pressure on the round ligaments and adjust the sacroiliac joints. So we'll roll that clip as well.
Go. I started coming here when I was pregnant for the first time in my life. It made a world of difference. My labor delivery was super easy. The doctors were able to put him head down in my second trimester, so I had nothing to worry about. And I labored and delivered well within 3 hours, and he was out. And as a first-time mom, I'm counting my blessings, and I really attribute it to coming here and working out, but pretty much coming here and keeping myself pain-free throughout my pregnancy.
So Dr. Rubenstein here is 33 weeks into her pregnancy. So we're going to do the same thing. We're going to do the Webster breech technique, and we're going to check for a full spine chiropractic analysis. So again, we're going to start with checking her legs. Check the leg length. And look for restriction here. There's a little more restriction on her right side, so I'm going to work on the right side here of her sacrum. So let's lay right on your side here, Doc. I'll go for a little pillow for her head. And let's lay right on your back there. What we're going to do here, there's a ligament called the round ligament around the uterus. We're going to do the opposite side of the sacrum that we worked on. I'm going to make sure that ligament is nice and loose. Makes for a much easier and smoother labor and delivery process. I'm just going to apply pressure here at the round ligament. I'm going to hold it there for about 30 seconds or so. So you may feel the baby start to flutter or move around a little bit here. A lot of times the baby will start to move once we do this. Facing down again, I'm going to check and see how we did. Just going to recheck the legs here, check our motion. It's a lot easier now on the legs. And we did great there, Doc.
So you see the Webster breech technique is very gentle, is very effective, and it has a good percentage to get the babies to flip. Now, a lot of times, too, we may get the baby to flip, then they may go back. So a lot of times it's repetitive that last week or two before the end of the pregnancy to make sure the baby will stay head down, too.
I mean, that's with everything with chiropractic. We want to make sure that we're not fixing anything. We're just making sure your body's functioning the way it should. Right. So you have to stay under chiropractic
time and repetition
care
is important.
And
right.
keep coming in to make sure you're getting checked. I mean, don't come in, the baby flips, and say, oh, I'm fixed.
Right,
That's not what we're looking for. We're looking to make sure that we help throughout the whole labor and even after the labor into the delivery. We want to make sure your body's functioning properly. So, yeah, I hope the people who think we can flip the babies, don't just come in for that one adjustment.
Right, right. And sometimes they flip, sometimes they don't. A good percentage of the time they do flip, but what we're doing is a technique to try to get the babies to flip, and works very well, but although there are some times where the baby may not flip, depending on the presentation. You know, if side lying is a little bit harder, certain breech presentations are a little harder to flip than others.
Dr. Larry Webster, the creator of the technique, said his percentages, I mean, he created the technique, were over 85%. I mean, that's good. That's huge.
Yeah. I'm maybe not quite at 85%. He's the inventor.
He's the creator of the technique.
But our percentages are pretty good. We usually see, you know, at least 60 or 70% of people where they do start to flip. And then we have another study we'd like to go over, actually, a survey of 100 patients. We could get a filming of that study there.
So the study is from 100 chiropractic patients in a private clinic in Norway. And what it was is they took all the records. Some of the patients had been in before pregnancy, some had been in for a few years, some had just started in the middle of pregnancy. And what it is they took it throughout the whole pregnancy. They took just the records from those 9 months of the patients. And the results of 90% of the patients arrived with some sort of low back pain. Other had pain in other areas, but the majority of the pregnant women, their complaint was in that low back area that we were speaking of earlier, in that SI joint, had the sciatic pain. And throughout the whole case study, it was, I mean, most of the people, if they got them in time, they tried to do it throughout the whole pregnancy. But the results were incredible. Over 90% of the patients got relief from their low back symptoms under chiropractic care. So again, I mean, we're talking about Dr. Larry Webster had 85% of patients that were able to flip. Here we had a practice of a chiropractor in Norway, had 100 people, and over 90% of them had positive results under chiropractic care. So 90%, I mean, we're talking about successful numbers here, and pregnant women, they have enough to worry about. The last thing they need to worry about is back pain. Right. I mean, and so many people think, oh, back pain's normal for pregnancy, but it's not. It's a common thing.
Doesn't have to be.
It's common during pregnancy, but it's not normal. I mean, like, pain is not normal.
We also see a lot of pregnant women that have more headaches than usual during their pregnancy too. We see a lot of that, and through cervical adjustments, we can absolutely help with a lot of their headaches as well.
Absolutely, because I mean, that hormone that's released, relaxin's not just released to the hips, it's released throughout the whole body.
Everywhere.
So
foot pain, hip pain, knee pain, everything can be involved as well, especially just carrying the baby around. Puts a lot of extra pressure on a lot of the joints. We have another study here. This is Dr. Fallon did this study, Proceedings of the World Chiropractic Congress in 1991. Talked about subjects who received chiropractic care from at least the 10th week of pregnancy through labor and delivery experienced mean labor times, which are average labor times, significantly reduced compared to controls. Prima gravidae, which is extreme morning sickness, those subjects received chiropractic averaged 24% shorter labor times. 24%. May not sound like a big percent, but you've gone through labor. That's quite a big percent shorter labor time. Imagine how hard and how traumatic and painful that is for a woman. 24% shorter labor time.
I mean, I'll talk about 24%. I know our first child, the labor was 4 days. 24%. That makes the labor 3 days. That's a whole day less.
Day. That's crazy.
So, I mean, 24%, I mean, you're talking 4 hours to 3 hours isn't so much, but from 4 days to 3 days, we're talking, that's huge. And I know those
it would have been nicer.
Yeah, those put a lot of stress on everybody. So.
And then the study even goes on to talk about how multiparous subjects, or people with twins, triplets, and beyond, they receive chiropractic care had an average of 39% shorter labor times versus control groups.
I mean, that's incredible considering most twin labors either have some sort of complication or end in a C-section, so that be under chiropractic care and be 40% better labor time, that's pretty incredible.
That's fantastic. And so, you know, we just encourage mothers out there that are expecting or thinking about expecting to keep their spine healthy again, even before conception is fantastic, but all the way through is great for the mother, for the baby, for the spines and development of both. Now, one thing that I see a lot of people may be scared of or deterred from is they think they can't be under chiropractic care during the first trimester as opposed to the rest of the pregnancy.
Yeah.
And what do you guys have to say about that?
I would say, I mean, I've been under chiropractic care. I'm a chiropractor. My wife, we're expecting our third child. I know it's safe and effective. I mean, we're talking about, that's the beginning of the development of the child. So why would we wait for the child to already have, maybe an issue already occurred that we could have taken care of if the spinal misalignments were gone? So it's definitely a misconception that chiropractic care shouldn't be utilized during the first trimester. I would say that's one of the most important times chiropractic care should be utilized of pregnant women, because all these vital organs of the baby are now being produced. So we want to make sure the signal from the mother to the child's getting there correctly, and that when it's growing at the time, I mean, a lot of people I've heard say, oh, you know, I heard that you shouldn't get under chiropractic care while you're beginning, you know, it could hurt the baby. It's 100% fallacy. It's not going to happen. We only side effect of chiropractic care, as I like to tell people, is a better overall outcome of life. So, I mean, if you want that, I think chiropractic care is for you.
And again, so, you know, it's gentle, it's effective. Now, were you under chiropractic care during your first trimesters as well?
I was, and I also find with patients who have morning sickness that it can help with that, because the same nerves that we're checking and adjusting lead to digestion and other complications that people usually don't think about.
That's fantastic. And we know with morning sickness that can be a really detrimental effect during pregnancy. It can make it very uncomfortable for women. And there had been in the past some side effects from some of the morning sickness drugs that were very contraindicated. And so anything natural to help with that can be fantastic as well, with morning sickness and the headaches that a lot of women get.
And then even in the second and third trimesters, people who have heartburn tend to get a little bit of relief as well.
Sure, and how does that happen?
Just making sure that the baby is in the right position, getting a little bit of pressure off of your GI tract, making sure that the acid stays down.
That makes sense. So as the baby develops and gets bigger, do they push on the stomach because there's not that much room in the
And
in the
helping
thorax,
us get
right?
that baby in the right position is so crucial.
Right, and especially even in the third trimester, the heartburn, you know, the
Yeah.
baby's big, or if there's twins or triplets even, there's just very little room for the stomach, and so it can push everything up and cause that heartburn. So positioning the baby correctly is fantastic
A lot
for
of people
the
think
mother and
it's
the baby.
because of a hairy child, but I would like to say that
That's a
it's
wives'
not
tale,
always
right?
the truth. It's not always a hairy child. It could be a big child in the wrong position, putting a lot of pressure on the stomach, and then the acid reflux occurs. So, I mean, if that baby's in the right position and the mother's nervous system is functioning properly, the overall outcome is a successful one.
So do you have a final statement or testimonial for pregnant mothers out there that you can say
I
for
would
the
just
pregnancy?
say that it's important that pregnant mothers make sure to take time to themselves to keep themselves healthy
That's
instead of
fantastic.
waiting.
That's fantastic. So remember that God gave you the gift of life, and what you do with that life is your gift back to God. This has been Ask the Chiropractor. I'm Dr. Adam Rodnick out of Commerce Township, Michigan. We're here with our two wonderful guests, Dr. Rubenstein and Dr. Rubenstein, and we will see you next time on Ask the Chiropractor. Have a great day.